I'm Rashid Zaman. I'm an epidemiologist working at the health portfolio at Oxford Policy Management as consultant. Global health security is a concept or a platform that brings in all the countries across the globe to respond to public health emergencies in a consolidated and coordinated way. And it's mostly to deal with the infectious diseases, say like in recently Ebola response or Zika. Threats to infectious disease were always there. We know about Black Deaths caused by plague, and we know about the Spanish flu in 1918-19 that killed millions of people. Nowadays, the threats are still there, but because of globalization, there is a different levels of threat where people moving from one country to another very quickly, and so has the viruses. That has, of course, with some other issues like climate change, antimicrobial resistance, for example, has made the whole thing much more complicated than it was before. For example, we have a program for Department for International Development called TDAP, Tackling the Diseases in Africa program, where we are supporting the WHO, Africa Regional Office, and countries in Africa to better respond to the public health emergencies in future. Moving forward, I think we need to make sure that we understand the importance and priority of this work. I mean, global health security is, of course, a new agenda towards something to do with a very old problem. So we need to understand the complexity of working in this area as well. And more importantly, trying to make sure that we are responding on time rather than, because in many cases the epidemics, they wouldn't wait for you to think and design and come back with a solution. It has to be, in many cases, a very rapid response. We need to be ready for that as well.